Welcome back at 7:14. Nearly 1 in 4 Americans suffer with arthritis, making it a leading cause of disability among adults. Dr. Brent Wallis with People's Health joins us this morning to shed light on what exactly arthritis is, the common types, and how to keep our joints healthy. Dr. Wallis, good morning. Thanks for being with us.
Good morning. Thanks for having me.
So let's start off first with an explanation of what arthritis is. And I know there are different types of this disease. Can you tell us a little bit about that?
Yeah, sure. So arthritis is really the general term that we use to describe about 100 different types of diseases, and all of them are related because they all cause pain in the joints. Obviously, wherever a bone meets a bone and you can move it, that's going to be one of those joint spaces that can be affected. And the two major types we see are osteoarthritis, which we also call bony arthritis, or rheumatoid arthritis, which is slightly different. Rheumatoid arthritis is actually an autoimmune disease that is a situation where your body actually attacks the joint itself and can cause damage and breakdown.
And obviously you mentioned there are almost 100 other types. So these are just the two main ones that people are most familiar with. Are there people who are most at risk, or are there things you can do to prevent having arthritis, suffering from arthritis?
Yeah, there definitely are some risk factors that we look at. Probably the biggest one is age. As you get older, your incidence of arthritis is going to increase. And in particular, we see it more often in women than men, especially when they are over the age of 50. The other group that we really get concerned about is people who were really, really active when they were younger, people who played sports, runners, joggers. Because they're using their joints more and may have some old injuries, that can actually develop into arthritis as you get older. And then there definitely is a family history component. So if your mom or dad have arthritis, there's a high chance that you're going to have it as well.
Obviously, some of those things you can't control, especially that genetic component of it there. But what can you do if you are diagnosed with arthritis, or maybe if you are predisposed to it? Can you slow down the possibility, or just slow down the onset of symptoms?
Yeah, it is going to develop in a lot of people as you get older, but there are a couple of things you can do. In particular, you want to try to avoid joint injuries if possible. You want to try to stay as active as possible. When you sit around and don't do much movement, your joints are going to get stiff and you're going to have more problems. So you want to do a low impact type of exercise. Something like walking can actually be very helpful to either prevent or delay the onset of more severe arthritis. So there are some things you can kind of look towards to try to prevent future problems.
And then if you do have problems, there, of course, are a lot of treatment options, but they all depend on, I guess, the type of arthritis, your other health issues, if you have any others, et cetera?
Yeah, absolutely. We do treat them differently. There are over-the-counter medications and prescription medications that can be used, but really don't discount something like lifestyle changes. That can make a really huge difference. So I mentioned staying active, but another thing to remember is if you are having a lot of swelling or joint pain, you want to make sure you take time to rest and actually get plenty of sleep, because that's going to help your body heal. One of the other things that you have to look at too is what you eat. Foods are very important because certain foods can be antioxidants or anti-inflammatories. So things like blueberries and raspberries and even some types of fatty fishes like salmon and tuna are anti-inflammatory type foods that can decrease your pain and decrease that swelling. So really holistic, healthy lifestyle can make a big difference with arthritis.
Well, Dr. Wallis, as always, we appreciate your time and insight.
Thank you. You have a great weekend.